Good afternoon, everyone. This is July Health Home Office Hours for AHI. Thanks for joining. My name is Travis Bethel. I'm the Health Home Operations Manager for the adult program. And we are on a new platform today, WebEx. So I am also admitting folks as I'm talking right now, which is like pretty interesting. And I wanted to just ask that folks bear with me for a minute until we get a majority on here. And then we'll get started in today's session. I'm not a triple threat. I don't have the ability to multitask, do 3 different things at once, so it slows me down a little bit. But we try. So today's office hours is going to be a few different topics, and I wanted to take some time to touch on the agenda. We're going to be going over policy and procedure today. We had a number of different policies come in the past month since our last office hours. We're going to touch on the HCBS 2-year audit, and then we're going to get on to the Children's Waiver HCBS training and qualification verification survey. And then from there, we're going to touch on some COVID-19 information. And then finally today, we'll wrap up in discussion on our health home business intelligence process as far as that's going. So we're going to jump in here. As you can see, we've got a lot of policy and procedure updates that we've had in the past month. Health home systems access and identity assurance. We're going to touch a little bit on today. That was sent out for serving adults and children. We also have interpreter services, access to services, conflict-free case management, all adults and children program. And then we got our HHSC CS transfer, which is a children's program policy, informed consent, adults and children initiating and maintaining OPWDD, level of care eligibility determination, serving children program, and our health home serving children, VMOD, EMOD, and AT policy and procedure, which is specific to the children's program. And then also the health home serving children transfer between HHSC and OPWDD comprehensive waiver, and that is, again, specific to children. So we have a number of updates. Hopefully folks had a chance to look them over as applicable. A number were annualized updates, so there were no changes, but we did have some brand new policies as well, such as health home systems access, in the initiating and maintain OPWDD, ICF level of care, the VMOD, EMOD, and the transfer between health home serving children, OPWDD comprehensive waiver. So a lot of new policies. So I didn't know if anybody had any questions at the moment around any of those new policies. We are going to talk further about the systems access shortly. Any questions on the policies that we had sent out in the last month? Okay. And then you'll see too, before I go further, just jumped ahead. You'll see too that we have upcoming policies that are going to be forth, and that's the outreach and engagement policy, the HCM activities and billing protocols for managing newly referred individuals from excluded settings. We're going to do a HART policy update. We've been holding on that for a bit just to see what's going on with HART. Notice decision and fair hearing, and then the quality assurance policy is going to be updated as well. So those are all forthcoming and will be your way shortly once we get them updated. So as always, we had our health home webpage. This is really interesting, trying to admit everybody at the same time I'm talking. The health home webpage is always going to have our most updated policies and procedures for folks to access, so please utilize that as a resource. So I'm going to turn it over to Jessica at this point to talk about the Children's Health Home HCBS audit. Jessica?
Hi, can you hear me, Travis?
Yes.
Okay, perfect. You know I love my WebEx. So we just had our second HCBS audit. It occurred the 6th through the 9th, and it was for the second waiver year, which was 4/1/2020 to 3/31/2021. Throughout the entire health home, we had 7 charts selected. 4 of the 7 that were selected were HCBS eligible, and they were enrolled youth in HCBS and in health home. 3 of the 7 that were assessed by the auditors were actually assessed as ineligible. So those were youth that were enrolled in health home that we wanted to pursue HCBS for, and they turned out to be ineligible. So 3 of those folks were audited. We will receive a formal summary in a few months, and they did indicate that we will receive member level data this time. The first round, it was just an overview. We didn't know which chart had each deficiency. This time around, they are letting us know that they will be giving that to us. On 7/16, that's where we had our exit conference, and that's where they reviewed overall themes that were similar to year 1. Next slide, Travis. So year 2 themes, again, consents were brought up. They were brought up for year 1. Basically, the consents are present in our charts, which is excellent. But what they are noticing is that they are not completely filled out. You have to make sure that every blank is filled in. You don't leave any blanks or check boxes. You have to make sure that everything is checked. So I would recommend that when you're sitting with the family and you're getting, 80 pieces of paper signed before you upload it into the record, just give it a double check just to make sure that everything's filled out. Again, this time around, there was lack of detailed notes, and specifically this time around, they noticed that it lacked evidence of discussion of HCBS with the family leading up to the level of care and the referral. So on the back end, they note that our care managers are talking to our families about the HCBS process and getting a level of care, and that it can get them access to a higher level of service. Those conversations are obviously happening because they're seeing the level of care is done and the HCBS referrals, but the discussion with the families is not being noted in our charts. So we just want to make sure that when we're meeting with our families and we have the discussion of HCBS with them, we do note that in the chart in a detailed note. So in this instance, the longer the note and the more detail is actually the better. Something new that came out on year 2 was the plan of care being signed. Due to the pandemic, we had allowed for verbal consent of plan of cares, so they didn't see a wet ink signature or an electronic signature, but they also did not see a clear indication that the family approved of the plan of care in the chart. This should be something that we are moving away from, and we're actually going to touch on later in today's office hours. But really, every single form that we have now should not be a verbal consent. It really should be either wet ink or an electronic signature. The other thing that they noted was our notice of decision. The notice of decision form is present in the chart, which is excellent. But what they were really looking for was the evidence of fair hearing rights discussed with the families. And this is really in particular to those 3 cases that were ineligible. So if you assess a family and they actually come out as ineligible for HCBS, the form was there letting them know that they were ineligible and they had a fair hearing. But in the notes section of the chart, it didn't show evidence that the care manager actually had that discussion with the families. So if you do have a youth that comes out ineligible, you want to make sure that you're noting your discussion with the family in progress notes, and that you are discussing the fact that the family does have a right to a fair hearing and can overturn that decision if they don't agree with it. Does anyone have any questions about the HCBS audit? Okay, I will continue to make updates to some policies and some trainings. I've been doing that since the year 1 audit. And once we get the detailed information back from the state, I will reach out to those CMAs individually. Last thing is an email was sent out on the 14th from the Department of Health, and it was on HCBS training and qualification verification survey. This was for care managers. Initially, there was a glitch in this survey that went out. I then re-forwarded it out to everyone. They told me that the survey has been fixed. So if you go and click on the link, you should be able to complete it just fine. It is due by, I believe it's Friday is the 30th, yes. And if your CMA is with more than one health home, you only need to complete it once. So you don't have to complete it once per health home. You just, as a CMA, need to complete it one time. And then on this slide is the link to the survey. But if you need me to re-forward you the original email, just let me know and I can do that as well. Does anyone have any questions on this survey?
All right, thank you, Jessica.
Thanks.
And we're going to turn it over to you. Systems access and identifying assurance.
Awesome. Thanks, Travis. So with all of the new policies and procedures that have come out, we wanted to just allocate some time specific to the systems access and identity assurance. That is really a tongue twister. Understanding that there might be some questions related to it, I just wanted to say it really isn't much different than the process we've been following, where we've asked you to submit a form basically when you're requesting access for a new user, or when we need to deactivate someone from your organization. It's just formalizing that and taking it one step further, where we're asking for you to name someone for your organization who is verifying identity. So all of you will have someone currently who facilitates this process, where you basically collect documentation and you verify that against either remotely or in person, that the person is indeed who they say they are. So when you now request access to any of our systems, you will name who that person is and who verified identity, along with the other information that you previously provided. This is really in line with our system and security plan and what is required by the state of New York for identity assurance. So we just kind of wanted to open it up for any questions, but just to kind of talk a little bit more formally about what has changed as part of this process. Just pausing for 30 seconds. I talk fast, so I try to take breaks. The other new thing that you'll see on your end is that every quarter, we're going to send you a list of your users as requested who are active in our system, and just ask you to verify that those individuals are still with your organization and still need access at the same level, just as a way to kind of make sure that our user list is active, up to date. We know you submit these forms timely when someone leaves your organization, but we just need to have a QA process in place to be sure that our list is accurate, and that there isn't any instances where maybe someone has left your organization, maybe you forgot to submit the form. It'll just be a good way to kind of validate that. And then just as another note, we will be sending out a list here shortly. I anticipate end of this week or early next week, but we will go over that in a little bit more detail a little later in office hours. Any questions about that new policy and the procedure?
And this is Lori. I apologize, I had to step out a second, but Just one question I have, and I missed the previous slide. So we have a staff person who is a care manager that does relief for us. So she fills in when we need her, we can call her in. Should we leave her on as active, or should we deactivate if it's going to be a period of time? How hard is it to get her reactivated?
I would say if she is not, if let's say if she hasn't gone into the system in the past 30 days, I would say you might want to deactivate and then just reactivate if and when she's deployed to work for your organization. If it's somewhat more frequent, I think it's fine to leave that person as active. And just as a side note, there is some functionality within NetSmart, and Taylor can kind of keep me honest on this, where your user will automatically deactivate after a certain number of days as far as their multi-factor authentication. So that particular user, if they hadn't logged in, they would essentially lose access anyway. We on our end need to go into the system and make sure that that deactivation is complete when appropriate.
Okay.
Does that make sense? That was a lot
Yeah.
of like, okay, good. Any questions? I wanted to just take some time because I know it is a different process, a little bit of a different workflow. And the person who's verifying identity may very well not be you, the CMA supervisor. It could be someone else in your organization. And it really doesn't matter to us what the role is or who it is. We just need to make sure that the person who's actually laying eyes on the document and doing the verification is identified. All right, great.
Thank you, Ann.
Got it.
So along with that policy, we have our new form, and we did some updates on it to reflect the policy itself. So we have made the form all encompassing in the sense that, any type of, if it's a new user, an update for a name, updated role, or if you're deactivating the user, you can use the same form to submit. So I'll be sending that out to the network shortly after office hours so that everyone has the PDF fillable version to that. And we'll also be putting it on our AHI website so that it can be located there as well for folks to access. But you're going to have a drop-down box in some of the sections, such as agency name. You should be able to click on that toggle, and it'll list the different organizations in the network. So it should be a quick click and go to fill out. As Ann indicated, the registration authority, whoever that person is going to be in your organization, would be identified. The user's first name, last name, date of birth, their email address. We're asking for the phone number as well to enter into the system for purposes, and then what population that person serves, if they're going to be a new user or if there's a change in their role for an update. And then the systems access request section, a little bit below the middle of the form. Predominantly we're going to have NetSmart Care Manager requests, but we also are including Millen, and then our new Data Den, which is the Power BI platform that was brought up in our last office hours. We have an official new name for that called the Data Den or Data Den, depending on how you want to pronounce data or data. And, so that's going to be one of those three systems access that you would use this form for. And the security roles that are identified for NetSmart only are going to be administrator, care manager, outreach specialist, supervisor, HARP care manager, and then we have an auditor role that's been put forth in the recent months, folks. And then there's another section if there's a unique circumstance that you wanted to talk about or to put a request in for. And then room for signatures. And we're asking that this goes right to the health home email because the process for who's entering this in is changing as well. I know historically I had been doing it quite a bit. Taylor's done quite a few, and others from time to time have done that. But we're rerouting the process now, so we're asking that it goes through the health home email so that people can get the stuff in timely fashion, because that email address is monitored frequently throughout each day. Were there any questions on the add change user form itself that anybody wanted to ask, or anything they want to talk about in relation to it? Okay, well, as always, if you have questions, please reach out and we can tackle them when they come. So we'll have this form out shortly, and we appreciate everybody adapting to this change in process. We wanted to switch gears a little bit, just touch base on COVID. So we have the state of emergency. I know New York State, the governor pulled the emergency status. The Department of Health is still operating under the federal emergency status. And we're being told at this point, through this snapshot of a document that you have here, that the flexibilities will continue to remain for the time being for the public health emergency. So the waiver that was put in place around the public health emergency still stands, but that will be coming to the end in the not so distant future, once the federal state of emergency has been pulled back. So the Department of Health will notify health homes and care management agencies at that point, once that has been relayed to the Department of Health, and then they move forward with this decision. And what's going to happen is we'll have at least 30 days prior to the termination of the flexibilities to make adjustments to get back in line to what prior policy had put in place. In particular, when you get into plans of care, comprehensive assessment, that 30-day timeline will help make sure that we're adjusting back to the 60 days through the requirement to get those plans completed. There is going to be a look at whether or not electronic signature will remain. That is something that DOH is indicating that likely will, but there will be more to come on that. But they're very positive about the prospect that is going to continue. Electronic signature will be allowed once this waiver is pulled. And really the message too is that verbal consent, even though it's still allowed at the moment, it should be a last resort as much as possible, because we want to move back towards that wet or electronic signature moving forward. The other thing that DOH had brought up along lines of this waiver as well is just a reminder that face-to-face do not, on the adult side of the program, they don't have a required outside of Health Home Plus and AOT. So, just to keep that in mind, that the face-to-faces will continue through Health Home Plus, AOT. OMH has indicated that they're not looking to pull those face-to-face visits out of the picture at this point. So they're expecting that that's going to be intact once the waiver pulls back. And there's not a lot of discussion around telehealth either for Health Home Plus, at least on OMH's perspective at this point. They're not looking to move to telehealth for Health Home Plus members. The other thing is telehealth itself is something that is being explored, but in general for adult health home, but there really hasn't been a determination at this point. There would be more to come if there were to be further progression down that track. Those are the big to-dos that were coming forward that we really want to prepare for, is just getting back to face-to-face as much as possible, getting those written signatures, and of course being safe about all of it as well. We don't want people to be in unsafe scenarios, but if it's an ideal circumstance where people are comfortable and precautions are put forth, please encourage folks to do those face-to-face and acquire those electronic and written signatures. Is there any questions or comments around where we're at as far as the waiver through Department of Health or along the state of emergency? Okay, we'll keep people up to date then as things come forward more. The other thing I just want to mention quickly again is just that documentation piece. I've had this slide up the last couple months. I just want to make sure I'm reiterating it so that folks are documenting. They're getting those signatures within the 60 days, electronic signature to written signature for consents. It's documented in the case notes. And, when that consent is obtained, it's documented that it was obtained as well. So, I know folks are doing their due diligence about that, but, that is something DOH is really stressing as well when they're talking with health homes. So I just want to make sure we're sharing that message. I wanted to mention too, we just completed recording, Jessica and I actually just completed recording training modules for Plan of Care. I know it's something we've talked about for a while now. It is coming to fruition. The modules are under review right now and final editing, and we're hoping to have them up on our AHI training webpage in the very near future once the editing and review is complete. And they will be accessible for folks to go on and view. And if you have questions, obviously you can reach out through the health home email along those lines. We broke it out into 6 modules, as you see here. So we'll have the care planning theory that we're going to be discussing, the different assessments for care planning, the developing of a care plan, what goes into that. There's a discussion about goals and SMART goals and the different types of how you write goals and ways about doing that, objectives and notes, and then the amending of the plan of care itself. So, we really tried to break it out in areas so that there were succinct topic areas throughout this training. And we hope it's beneficial for folks. I know it's something that a number of you have asked for and we're inquiring about over the last year and a half, especially. And we're excited to bring it forward for everyone. So that's coming soon. At this point, I'm going to turn it back over to Ann.
Hello again, everyone. Just wanted to ask you to save some dates. We are busy working in the data den and are starting to produce and publish some of our use cases. So we wanted to kind of gear up for some training. We're planning on user-based, role-based training. So we'd like to offer supervisors training August 16th. And then we'll do a series of trainings for care managers. That would be the rest of that week, which is August 17th through August 20th. You will be getting invites, which we will be sending out in the very near future. But we will be looking for your feedback as far as who you would like to have access to the data den. And we will kind of give you a glimpse here in a minute of what that request will look like. But for now, if you could just please save those dates. And here we go, here it is. So this is a sample of the spreadsheet you're going to receive where we're going to ask you to verify that the users listed on your organization are still current and active and require access. And then as part of that, you can see Taylor added a column here where you can indicate if that particular user will also require access to the data den. And again, the data den, the purpose of that is to give you access and insight to your own information. You will only see information for your organization. If you are a care manager logging in, if that's your role, you will only see those members or patients that are on your panel. So we wanted you to kind of get a little familiar with the QA process as it relates to system access and identity assurance, as well as that we're going to ask you to let us know who needs access to the data den via this spreadsheet.
Hey, Ann, this is Renee with Alliance. Quick question. From the lead's perspective, because I mean, certainly all of our leadership for AHI team at Alliance would want to be in the data den, what would you think a case manager would do in there? Obviously, I might be able to answer that if I knew what it looked like, but just I'm curious what your thoughts are there.
Yeah, so I'll answer that, and then before I answer, I will say that part of the agenda for today, we have one of our analysts on from Canton and Company who's been working on the development, who's going to show us a little demo. But before we do that, I would say it's really, from my view, from my perspective, I would want the care managers to have access because they're going to be able to see things like I'll call them work lists for lack of a better term at this point, but they would be able to see if they had care plans coming due, comprehensive assessments coming due, and that kind of ties into what we're going to show today. But really, I mean, just their overall panel, their overall enrollment, you know, there's a lot of different information that I think would be helpful. If you kind of think of it from the perspective of trying to eliminate every spreadsheet you've ever kept on the side of your desk when you're managing your population, that's kind of really the end game that we're shooting for, that everything that you would need to kind of help organize and do your work and to close gaps in care would be available through the data den.
Thank you. That's super helpful.
And I just want to verify, Isaiah, are you on?
I am, Ann. Can you hear me okay?
Yes, we can hear you. Would you just mind taking 30 seconds to introduce yourself?
Sure. My name is Isaiah Rosine. I work with Canton and Company as a data analyst and project manager. I have, excuse me, worked with data in the healthcare and individuals with disability spaces for I'm going to say about 10 years, and I have prior experience working with a health system, health home agencies. So health homes are kind of in a sweet space for me. And I really enjoy working in the population health space in general.
Awesome. Thanks, Isaiah. So what we're going to show you all today is, and Isaiah, you've supported health homes, so you kind of have a sense of who is your audience today. It's supervisors and care managers from about 26 different organizations in the AHI Health Home Network. So how's that for an audience? You got a big one today. So what we're hoping to show everybody today is we wanted to give you just a brief glimpse of what the user interface might look like as we're moving forward and prior to training, just to kind of give a taste and flavor so that it's not totally unfamiliar when we get to the point of end user training. So Isaiah, would you mind taking control of the screen?
Yeah, absolutely. I'll say just a couple of words before I share my screen. Experience tells me that once I share my screen, people are much more interested in what they're seeing than necessarily what I'm saying. The data that we're about to show you is de-identified data on your health home, and we're going to try and take you through as if you are a care manager or maybe a manager at a health home that is trying to view data for yourself. You're going to see a really limited set of measures today. This is really just the tip of the iceberg, but I think you'll get a sense of the direction we're headed in. And feel very free to interrupt me at any time you want while I'm showing you things and to ask me questions about everything and anything you see. So without further ado, is everybody able to see my screen?
Yep,
Yes.
you can see it.
Yes.
Terrific. So we're using a tool that's called Power BI, and right now you're looking at Power BI through the lens of the designer. That's somebody like me. Think of the guy behind the curtain pulling the levers in the Wizard of Oz that makes the show look good for everybody. So when you come into Power BI, you won't have all these nifty doodads and buttons. You're really just going to see what we see here in the middle of the screen now. And so that's where I'm going to focus our attention. We have a few tabs across the bottom. And I think when you see it in the final version, they'll actually be cascaded on the left side. And each of them represents a different report that you can look at. And all the reports are interactive. I'll take you through them. This one's a little higher level, and you'll see by the time we're done today, something that's very detailed and specific and oriented towards care managers themselves. This first report is showing us missing care plans and comprehensive assessments. And I've set things up so that it's as if we belong to one care management agency, and there's numbers here. Forgive me, I didn't have time to think of like a nifty name instead of numbers, so we'll just have to go with boring number 92. We're members of care management agency 92, maybe a care manager or a supervisor for care management agency number 92. And so when we log in, we're only going to see data for care management agency 92. And or somebody from the lead health home would actually be able to see the same information, but for all the downstream health home agencies. This top left area, and this is the sort of thing that you'll see throughout, has filters that you could use to filter the data that you're looking at. So if you were able to see multiple care management agencies, you could click here and choose different care management agencies. Of course, there's only the one that we can select now. There are 2 care managers in here for this agency, agency 92, and care manager 142 and care manager 914. And when you look at these lists, I think that I disabled it, but you can actually search if there's a specific care manager that works for you that you would want to look up if you're a supervisor. And lastly, you can look up specific clients if you want. You see the search bar right here. So for instance, I'll just start typing a number and hope I get lucky. Yeah, 99, and everybody who has 99 in their name pops up. So it's very easy to look up individuals. We see that this care management agency 92 has 41 currently enrolled members, and 6 are missing a care plan and 7 are missing a comprehensive assessment. So I just click the plus next to the care management agency number. I'll then see the care managers, and it doesn't feel as natural to you because it's all numbers, but imagine you saw AHI here, and then under AHI you'd see people's names, and you'd recognize their names because that'd be care managers or your own name. And then if you click a plus next to that, you'll see clients. These are de-identified IDs, but you'd see your clients' names that you are the primary care manager for, and you now see who's missing a care plan and who's missing a comprehensive assessment, and you know who you should go and make sure that the care plan and the assessment are in place. You can click plus one more time, and now you'll see this date, and I'd like to get it labeled. I apologize, it's not labeled here yet, but this represents the consent date for this client, and it gives you a little idea that it has been 7-8 months since this person enrolled in the health home program, and we're still missing a care plan and an assessment. Just a good data point for you. I'll pause for just a second. Does anybody have any questions for me so far? Okay. This next tab We're still just looking at Care Management Agency 92. We've got the same filters. And we've got summary numbers still over here. This time they're a little bit different. Now we're looking at overdue comprehensive assessments, those that have not been updated in the last year. Upcoming assessments, so those that are due within 60 days or less. And the same for care plans. And again, just like the prior tab, I could click plus and drill down in and see who this represents. My care management agency. This number 914 represents a care manager's name, and this would represent all their clients that have either an upcoming assessment, an upcoming care plan, or an overdue one. So you can see this care manager has 6 upcoming assessments, 3 upcoming care plans. Let me just show you, because this has a couple that are overdue, so you can see which client has which client here has an overdue assessment and an overdue care plan. This last tab is similar to the one we just looked at. The layout's the same, the summary numbers are the same. What's different is the information in this center report area. Again, I'm looking at the same Care Management Agency 92. We have the same 2 care managers, 142 and 914. Well, now when I look at the figures here, I can see that they have 18 clients that they are the care manager for. And when I click a plus, here's all 18. And it will show me how many days it's been since their last care plan was updated, and how many days it's been since their last comprehensive assessment was updated. And we set it up so that it will flag in red the people that are over 365 days. So they're, on a corrective action plan. It highlights in yellow, a shade of yellow, those that are within 60 days of hitting that year mark, 365 days. And the shades get redder and redder. You'll notice this is very orange because we're approaching that year mark. And then it's a shade of green for everybody that is, under that 60-day window. And, we have a bit of time before they need to be updated. And so I heard some of you asking why would I want a care manager to have access? Well, now you as the supervisor could come in and see which of your care managers have individual clients that have upcoming and overdue care plans or assessments. But the care managers themselves can come in here and see exactly who that's reflected in the records, who exactly is overdue and they're on corrective action for, and who exactly is coming due. I could share with you that we put a similar report together for the other health home that I worked with. And I think within a few months, the number of clients that were out of compliance decreased significantly. And the care management staff that had access to the report really appreciated it and expressed that it was very helpful to them, because now they could at any time look at information about themselves that they're being held accountable for, and take action based on what they were seeing. And that's it. That's what I have to show you today. I'll just emphasize that this is really just the tip of the iceberg. I think you can see the direction we're headed and the types. You can see how we could extend the same sort of thinking to other areas that are relevant to you. Are there any questions for me, or comments, or criticisms?
Thank you, Isaiah, for walking us through this. I think my question about having case managers on it was more that, like, as a self-proclaimed sort of data nerd myself, like, I'm wicked excited about getting in here. I just want to make sure that there's enough value for the case managers rather than them just feeling like they're getting another platform to log into. But this was really helpful.
Yeah.
And I think too, Renee, part of what I'm excited about is trying to take some of the manual weight off the supervisors themselves, because when we send out a report, you then, I'm assuming, have to break it apart and then send it to each care manager, and just really saving that step so that you have the assurance that you know the care manager can see the information, and so can you, because you'll see everything for every you know, care manager that you oversee. So it'll hopefully save some time and energy on the supervisor's part as well.
We have one question in the chat. It's asking if the platform has a lag to it as far as information coming in.
So the vast majority of the information that is being reported in here is coming from NetSmart directly, and so it should be updated daily, at least, if not a couple times a day. That's a really great question.
Thank you, Isaiah. Does that help answer your question, Rick? Does that help clarify a little bit?
Yeah, so I just had a question and a comment. This is Bob. This looks pretty good. So are there going to be more of these trainings, Isaiah? As you mentioned, this is the tip of the iceberg.
Yeah, definitely, Bob. I'll let Ann talk more about the details. Today was really not even meant as a training per se, but just to, I would say, whet your appetite and give you sort of a feel for what's coming. I'm sure Ann's talked to you a bunch about it, but it's quite different to talk about it and to see it. And so we really are trying to give you a flavor for it.
Yep, and as I said earlier in office hours, we're planning training, and we'll be sending out invites for the week of August 16th, and we included the save the dates in the deck, which Travis will send out at the end of the session. And just if I didn't mention it earlier, as with all of our other trainings, we will be recording sessions and posting them out on the website. In the instance that, you know, maybe you have staff that can't attend, or you have new staff that start later. I mean, who knows, right? Those things do happen. We'll make the trainings available out on the website so that you can have folks kind of view them at their leisure.
Okay, so this is going to be on the trainings on the week of the 16th. There'll be more of the Power BI presentations.
Yeah, it's really the vision for the week of the 16th is really going to be giving those people who would like access to DataDen the actual training in how to log in, what does that look like, how do I navigate the user interface, you know, kind of think of how we rolled out NetSmart, obviously this is a much smaller scale because it's not a transactional system, but just to kind of give you a more hands-on live experience and training.
Okay, great. Thanks.
And the other thing too is just, I know we say this a lot, but if there are things that you would like to see built in this environment, if there is information where you're like, oh, I wish I had a report that told me this, or I wish I had a report that told me that, please email the Health Home email and let us know. And we will do our very best to make sure that your use case is included in our inventory, and that we're working on getting the reports that would be most meaningful to you deployed in the system.
A couple small things that I just thought of too. So you noticed when we logged in, we clicked on the care management agency over here, and then the individual care manager. An individual care manager that logs in is only going to see the data for themselves. So in a sense, it becomes very user friendly, because there's really not much clicking to do, and it's their information is right in front of them. The other thing I thought I'd mention, because Ann was asking about this earlier today, but this data that's in here, let's say I'm an individual care manager and I want to print out this list so that then I can go sit and work on care plans. You actually have this option up here. You can click these three buttons and click export data, and it will export a CSV of the information that then you can open in the CSV, an Excel file. Will really mirror what's here. It won't have the colors in it, but the same data will be in there. The care manager's name, the names of all the clients, and then the number of days since their last updates. So the data is very easy to get out of here so that you can use it as well.
I have a question. You said that only care managers would be able to see their own, but what happens if uncovering another caseload or another couple clients from another case manager? Would we be able to see their information?
Good question. I'll say there's a sort of a part A and a part B response to that. If your care management agency and you know, if you're okay with individual care managers seeing others' information, that's possible, that's doable. We could just limit it so you only see information for your agency instead of just for who you're assigned to. It's part A. Part B is limiting what you see is connected to whoever the primary care manager is that's assigned in NetSmart. So if you change that designation, you would automatically be able to see, you know, the data for other people. So if you're covering for an extended period and you just change that, then that would change what you could see as well.
Thank you.
At the other health home client that I worked with, they just had data limited at the organizational level. So I believe all their care managers were able to see the same sort of data for each other. And that's just how they chose to go about it.
Isaiah, this is Travis from the health home, and I think this is very exciting. I like the idea that people can have a click away, if you will, to get their own information so they can better get a grip on, you know, all the number of folks they're working with as far as when things are due and when they're not, versus waiting for a monthly report, which is also timely in many respects, but not as timely as a click of a button. If you know, if you're saying that the platform gets updated daily for the most part, that's going to be just profound, I think, to help people on their day-to-day work.
Right.
Did anybody have any other questions for Isaiah or any thoughts at this point around the sampling of what the system can do? Isaiah, thank you very much.
My pleasure, everybody. Have a good day.
So more to come with the Data Den. Stay tuned.
The data folks will return to the den now and continue working.
Yeah, just let me know when I'm allowed out again, right?
Right, exactly. Not until August 16th, Isaiah. Then you can put your training hat on.
Okay, so we're ending our time, unless people have more questions or anything they wanted to talk about. But just wanted to share our health home staff again, so folks know who everyone is, and any questions folks would have, please send them to the health home email. And I just want to open it up for questions in general, if anybody has anything they want to talk about. don't
Just
see
Laura, I
anything.
just want to thank you guys again for, you know, all the effort and work you put in to try to simplify and support and, you know, all the care management agencies. So thank you.
Thank you, Lori. We appreciate all the work that you all do. And we can put things and systems in place to make it easier for folks, and that's the least that can be done, right? Because everyone's extremely busy and there's a lot to remember and do. And I think, you know, things such as the data done is just going to help make things a little bit easier. Anything anybody else had to say or want to talk about? If not,
There's a question in the chat, Travis, about the care plan training, asking about a date for the care plan training.
Oh, the plan, when it's going to go up on the website? It should be within the next couple of weeks. It's going through final review, as I mentioned earlier, and the recordings are done. We just got to get the editing down. You know, like trim off on the end of each of the recording, just that type of stuff. So you're not looking at wonky stuff at the end of the recordings, and it ends clean for folks. And then it's just a matter of getting them processed through our communications requests to get them up on the site. So I would say within the next 2 weeks max, they should be up there for everyone. And I'll send something out to the network, letting folks know that they have been posted when they are there. Anything else anybody had?
Those are all the questions in the chat.
All right, thank you, Ann. Well, everybody, I hope you're enjoying some time off. If you haven't, if you have some time off coming up, I hope you have great weather and you enjoy that time off. And thank you all for all you do. And we'll talk soon. Have a good afternoon, everyone.
You too, Travis. Bye, Ann.
Bye, everybody.
Bye.